and welcome to this month's Call In Live from our Call In Live program at Can TV. My name is Sister Ya Simpson, and I am your community epidemiologist host with Tacts, the Association of Clinical Trial Services, where we bring science to the people. And today we have a special guest. We are welcoming back our student intern, Miss Ajua Pryor. Ajua?
Hi.
Hi. How's school going?
I'm doing well. I'm on the dean's list. I'm the executive head captain of my STEP team, and I created an open mic with the writing lab, which will continue next year with the Black Student Alliance.
Wow, that sounds like she's very busy. She needs scholarships and grants, so start working on that for her. So with Tacts, we would like to bring you what we do all the time. We definitely talk about health. As you can see, this is our motto, the Association of Clinical Trial Services. Again, this is our call-in at 312-738-10. What is it? 60. I know. I don't have my glasses on. And we have our very own Mr. Charles Patton, who is our people's counselor. So if you want to give a call to us, Mr. Patton would be the one taking in those calls. And if you have some questions, we will do our best to answer it. Again, our vice president for Tacts is Mr. Charles Patton. He is the people's counselor. And I'm Ya Simpson, the community epidemiologist, and we have our intern here, Miss Ajua Pryor, student at Johnson & Wales University. What are you, a junior now?
Yes, ma'am.
All right, graduate. So as we talk about the different aspects for this session today, I always give a shout out to some of our partners. We have CHF, Men and Women's Prison Ministry, Flow Photography, and of course Enterprises, National Black Agenda Consortium, and the AIDS Healthcare Foundation. They do and help support Tacts out and getting us all the way involved with healthcare and health issues. The one thing we talk about, and I'm going to keep pushing this, is that we're always looking at health equity. Say it with me, health equity. And we define what is health equity. Equity is not equality. Equity means getting what you need to get, as far as in this picture, the boxes that you need to get and achieve your highest health possible. Whereas equality is just everybody gets the same box, irrespective or irregardless of do you get to the best health possible. So we're not into just equality, we're into equity, getting what we need to get done so we can have the best health possible. That is what Tacts is promoting on this particular show. What we want from you in the community, if you could see this, is a three-pronged approach. We have the policy changes that really come from our governments. We have what we call these changes from institutions like our universities, but what we want you to focus on is the community changes, community capacity building. And if you can see, that triangle all leads to what we call a health equity. I always have to brief you on that because that is the way that we do well with Tacts. Now, today's focus, though, is going to be on adolescent health. That's why we got Miss Ajua Pryor here. Just in the background, the 2017 partner update from the Health of Chicago 2.0 just came out. And I'm on the side job, do work for the Chicago Department of Public Health, but I'm not working for them right now, I'm working for Tacts. But the point being is that this update is out, and they have a section in that update that focuses on just adolescent health. So today we really wanted to do that as well because we have Ms. Ajua Pryor here who can talk to us about some of the concepts around adolescent health. Now, it's a little hard to see this. I recognize the bullet statements aren't as clear as I wanted to be, but one of the things that we know we were going to deal with in the 6 concepts within the book, it talks about strengthening child and adolescent health. It has 6 components that it wants to focus on. We're going to focus on just 1 or 2 of them, which is around empowering and strengthening within adolescent health. that has to do with peers, and then, of course, talking about how teens can get better health. So it's hard to see those statements, but those are the 6, and we're only going to focus on 2. And by focusing on those 2, Ajua, I want to talk to you and ask you, how can we empower or how can we help to bring up the concept of teens, youth, adolescents? So we're talking between ages of 13 and 24, which you are, right?
Mm-hmm.
You all
20 years old.
What do you all call yourselves?
We call ourselves millennials. It's Generation Z. I don't know if that's a
Yeah,
thing.
no, yeah. I think they're trying to bring me out. I'm Generation X. So
But millennial is the more known term.
There you go. Absolutely. And in fact, if you're not sure about this, me and Mr. Charles Patton looked it up, and I was correct. Our former president, Barack Obama, does not belong to the millennial. He definitely belongs to, was it Generation X, or maybe even the generation before me. So that was a little bit of a bet that I won. But again, millennials, let's focus on you all, adolescent youth, 13 to 24-year-olds. We're going to delve into what can we do about your health. So tell us a little bit about where adolescents, or where you think youth should be on peer-to-peer, strengthening the health of each other.
Well, before you even get to peer, you have to know what home they come from, because all education or all foundation starts in the house. So if you are teaching your kids what it means to eat healthy, be healthy, and also not just teaching them, not just telling them, being your own example, being the best example for your kids that you can be, even though it does get hectic, I know people have work and things like that, or having to take care of the children themselves. Being the example is the best way to teach somebody.
Ooh, so it sounds like you might know this Ghanaian proverb. It says, the ruins of a nation begins in the homes of its people. But we can flip that. That's the Ghanaian proverb. We can say the Sister Ya and Princess Ajua proverb is if we can say the health of a family, the health of a nation begins in the homes of its family. So let's do that. So starting in the home, that's what you're getting at. The example needs to be set by, guess what, y'all? Parents.
So if your child sees you eating McDonald's every 3 days, if your child sees you eating Cheetos and Hot Crunchy Curls, and all of these things, your child doesn't see you eating Brussels sprouts, your child doesn't see you eating portion foods, then your child doesn't want to do that as well. We don't want to do anything we see our parents not doing.
Speaking of which, I got some Brussels sprouts at home. But yes, that's the first step. So again, this is a call-in live with Tacts, the Association of Clinical Trial Services, 312-738-1060. There you go. Now, Ajua, that was one example. Can you give us some other examples? Okay, I heard about the parenting, and one of the examples we have here is they can receive texts. Parents can get texts about your health when your, immunizations are due, or when your checkups are due for school. We went through that a lot.
That makes it way easier and it also helps you keep up with the times as well, because like I said earlier, life can get overwhelming. So if you get a text that reminds you, it's like, hey, your child's physical is due in a week, then that's better than the high school or your school giving you a form and you're like, oh no, I have to go get their physical in a week. It's a different level of panic. It's a different level of urgency that way.
And not to mention more communication. So you get the emails now, we're getting texts now, we're getting reminders to focus in on the health of our young people, our millenniums. Okay, in dealing with that, I think there were some things you wanted to share with us about the specific ways millenniums think about health. Do you think they feel like empowered, or do you think that they're distant?
I read this article, and it says that Comedy Space has done research, and they say that millennials feel about their health care as like they're on the outside looking in. And that's true. Not that my parents did not keep me educated on my health. It's just that you don't know everything that goes into making a doctor's appointment or getting medicine, or you just don't know because you're still young and your parents hide that type of stuff from you because it's not for you to worry about until you get older. And the issue is that it's not a seamless transition with your health It's more of like, I'll just wait till my mom does it, or I'll wait till my dad does it, or I'll just wait till I feel really sick, and not going to check up on yourself regularly because you don't know to, and your parents didn't tell you to. As well as the education in schools have also been affected, because there should be sex education as well as regular health education in schools, and that's not something that's very widespread or heard of.
Well, I will say that in the update that I showed you from 217, the Chicago Public School System is working with the health department to try to have better and more complete what they're calling sexual education. And that also includes Planned Parenthood, who said they would step in and provide gonorrhea and chlamydia screenings and, of course, wraparound services. So
yes,
it's
Planned
slow,
Parenthood,
but
if you ever feel embarrassed about any type of health services that you need, Planned Parenthood is a good place to start.
Wow.
Especially if you want to go by yourself or go with someone else and you don't want to give up information that might get back to your parents. Just go to Planned Parenthood and ask them what they can do for you if you can't do anything else.
Exactly. Good information there, Ajua. We have a caller to the Tacts call in live. What can I do for you, caller?
Yes. Can you hear me?
Yes, I can.
Okay. I was just thinking about years ago when I was a young kid. I'm 69 years old now. But there was a family structure.
Yes.
Everybody was working. The kids saw the mom and the dad working together. They saw the grandparents working. They had a structure to watch. Nowadays, there is no structure because the kids are having kids. If we can stop that and go back to the old ways, and they're not that old, they're the right way, I should say. Go back to the right way. Raise your family right. I knew that high school. High school that was I had to go through high school, no problem. Kids today go to school high and they don't learn anything. So let's go to the right way, and then maybe we can go back to being a great society again. Thank you.
Well, thank you, caller. I appreciate that. You want to react to that statement?
Yes, sir. So, I do get your comment about when it was back when you were a child, but these are different times for a reason. So we have to have different approaches. We have to meet the child where they are and not try to bring the child where we are, because you're not going to get to them like that. You need to meet someone on their level and then take them higher from there. So you say that the kids are having kids. Well, who telling them that that's okay? Why is there no sex education in high school? Then they wouldn't be having kids.
Wow.
You know, so you have to start at the root of the problem, which is economics and education, not the person themselves.
And that's part and parcel of it. But so thank you, Ajua, for that insight from the millennium's point of view. But let me give you a little insight from an epidemiological point of view. Thank you, caller, for saying that. However, I do have to correct and redirect. In fact, people were having babies at a much younger age than they are having them now. Most families were starting with young women having babies as early as 13 and 14, and they were starting their family. And let's be honest, I'm talking about a population, but as you get into subpopulations, you will find in the black population, especially those in the southern regions, were having full families with women, with young girls who were as young as 13, and they're having 2 and 3 children by the time they're 15, and married or with a person. So I have to have a little pushback on you, because historically speaking, especially for blacks or people of African descent in this country, the good old days were not always that good, and the reason that we were holding on to families is because at one time in our lives, we were separated from our families. We would have that child be taken from us or sold into slavery. So we've got some dynamics that the good old days was not always good. But I want to take from you what you offered, which was, why can't we have a family structure? And then that auspice, I agree with you, caller. Why can't we have a family structure that talks about the adults, the adolescents, the babies, and more important, let's do the full lifespan. We have to go from, going from babies to adolescents, like we have with our millennium, to adults, to seniors, and then transitioning. So there is a preference for that. And again, we just have to do things right, not just because what was done in the past, but what we could do better for the future. Is that okay? Is that okay, Millennium?
Yes, ma'am.
All right. Now, I want to pull your eyes to something else that I think the caller is getting at too, and I'm not sure how much as you can see this, but one of the health, and we call this vital signs. You can Google this. It's called Vital Signs, and it's for the African American health, and it's one of the fact sheets that came out. But basically, they're just trying to say that African Americans were, again, they're twice as much to have more issues than is compared to whites. They were 25% to have another issues compared to white. All these comparisons that I'm trying to get you to see here really has a lot to do with where we are in compared to others, especially whites, blacks, and others. So this particular slide is just talking about the deaths in African Americans ages 65 years, and older. Okay, so death in African Americans, everybody's deaths actually did go down, but black people had 43% with heart disease, 38% was with white, but 43% was black or African American. Cancer, again, African Americans had a higher percentage, 29% as compared to whites at 20%. Strokes, 41%, but actually the same as with whites. I'm only bringing up some of these social ills because it has to do with, unemployment, living in poverty, no home ownership. And I want to ask the callers and the millenniums, what do you all think about when you hear people say, well, the problems are around, let's deal with poverty? Do you think because of poverty that our health is worse just because we're poor?
Yes, poverty takes an immense toll on your mental health before it takes a toll on your physical health.
Uh-oh.
Because when you don't feel financially secure, the rest of your body, this is the thing of Maslow's hierarchy. When you don't have the rest of your things in order, then the rest of you is going to fall apart. It's only natural. And because black people were put into certain communities, certain areas, certain buildings for certain reasons that we all know the reasons why, and we all suffer from the same issues, and we know why that happens as well. And it was basically a setup from the beginning. Basically, our health wasn't going to be after the Great Migration. And the way that we migrated into the cities, yes. Our health was not in anyone's best interest when we moved up here. It was only that way we were taking up space.
And that's a very good point. Again, going back to the comment of the good old days. Well, the good old days were not good to everybody. And some of the things that you just mentioned, Ajua, our health was not given the priority. What was given the priority was, can we move these people to this area? Can we keep them contained? Can we exploit? And can we, more importantly, marginalize this particular sector because of the skin of their skin colors or in their culture?
And then in response to the Great Migration called the White Flight, and also with the White Flight came with the flight of resources as well to those other communities.
So that's economic development. Let's look at some other things here. These are some of what we call those social determinants, which in other words, they're saying that these are social factors around health risk, as Audra was mentioning, and mostly for African Americans. And if you look at this, if you could even see the slides, we want you to Google it and get this report. But for African Americans at younger ages, here you see a lot of the disparities, if you will, and I don't like that word, but a lot of the differences are for the ones that are younger ages. We look at the unemployment. Look at that. It's at the younger ages compared to the older ages. Here it is, we got 10 to 34. But then things like smoking, non-active, no home ownership, living in poverty. Those are the ones that we are trying to say that, as Audra was putting it, they matter, right? Black lives matter. And it matters whether they're employed. It matters whether they're in poverty or not. I do want to contextualize poverty. I'm a little different based on my research. It's not necessarily not having the money, but not having the access to quality resources. Let me bring up an example. There is a man that lives in Haiti whose age is now Haiti, right? He has no resources compared to what we have here in this country, but he is 108 years old and he moves as though he's 60 or 70. His health is better than most black men in America. He swims daily. And if you were to see a picture of him, you would never put him past 70 years old. You said, no, he's not that old. He looks that good at 108. And the reason being is it had nothing to do with how much money he had amassed in life. It had everything to do with how well he was able to utilize the resources in his community. What we're really saying is his food and nutrition was much better. He got sunlight every day. He was very active every day. And there is some, you said it, Ajua, there's some mental health that he was able to get that the black men in this country aren't getting. In other words,
that's another huge issue as well. Mental health in the black community is, the millennials know that it's largely ignored, and it's largely, it's almost disgusting to some people how the way they mistreat the mental health of black people, because, you know, your grandma would say, oh, that's a white problem. You don't want to kill yourself. That's a white problem. You're not depressed. You're not. Yes, I am. Why don't you listen to me? If I tell you there's children don't lie for the most part unless they have to. And I don't lie. I'm not a child anymore. But
she's a young adult.
They'll tell you what they want, or if they need something. If they can't, then they'll cry about it until you figure it out. So if someone tells you verbatim, I am depressed, I am anxious, I am this, then just like every other health problem, take them to the doctor and figure out what's wrong. But instead, it's swept under the rug, and we're told to seek for Jesus to answers instead of to the doctor.
You went to the call on the Jesus moment. But what we really, I want to just, and thank you, I want to actually put a little bit more out there, Ajua, as in take to the doctor, but I'm going to go a little bit further. I'm of the ilk that not just going to a doctor. I say go to a specialist providers. Some providers are not MDs. Some providers are specialists. They may not have the medical doctorate behind them, but they could be counselors. I want you to go to degreed or either credentialed people, but then there's a whole host of them. It's not just doctors, nurses. It's not just nurses. It's other mental health specialists. There's other types of substance abuse counselors, right? That's what we're talking about here. There's people who can be part of your team that can help you to mitigate some of these mental health and substance abuse issues. In fact, one of the things Tacts wants to promote is community health workers. One of the reasons that we're promoting the advent of community health workers being paid as a position, as a job, is because they're more able to get information to you quicker and hopefully bridge you between the doctor and the community, where there's a liaison that's helping both of them to understand each other. So often that the doctor is not able to spend more than 7 minutes or so, or 15 minutes or 20 minutes with a patient, to a person that's got an hour's or at least 2 days worth of issues, or for that matter, a year worth of issues. Well, this is where our community health workers can start using. Prevention specialists is one of them, people that are specializing in mental and substance abuse, just to be able to listen to you and to help you resolve, hopefully. But if we can't resolve the problem, let's at least work in mitigating it.
And I also want to piggyback off what you said. You said listen. That's one of the biggest issues that millennials are facing, is we're trying to force our parents to listen to us. The parents think that they know already. I was your age already. I went through that. I did that. No, you didn't. You didn't have an iPhone. You didn't have an iPhone. You didn't have a computer. You just learned how to use a computer yesterday. You did not have what we have today. Things are slightly different. I mean, the game may be the same, but there are different pieces added. So, just like I said earlier, when your child says they have a problem, address it like every other problem. You say what's wrong, you listen to them, and you move forward to the next step. Don't sweep it under the rug.
Wow, spoken from a true millennium right here on CAN TV Live. This again has been a wonderful conversation. Thank you so much for your insights, Ajua. That education is paying off, as you can hear for yourselves, and it does give us a different perspective. Again, this is Tacts, the Association of Clinical Trial Services, where we bring science to the people. And if you ever want to get more information from us personally, besides calling the call-in live number, you can always call me 312-961-6189. In fact, let me just show you our slide here where you can contact us either on email or Facebook. You can go Tacts space us, and you can also put something in there as well. Again, I want to thank all our guests. I want to first of all let you know I'm Sister Yaya, community epidemiologist. Here we have Ajua Pryor, our student intern, and you got to call or at least know that Mr. Charles Patton, the community counselor, the people's counselor, excuse me, I'm the community epidemiologist, he's the people's counselor. We are all here on behalf of Tacts to service you. If you ever want to contact us again, please know you can do that. Thank you so much, and again, welcome to the CAN TV Call-In Live Show. Have a good one till next month.